Assalamu alaikum. Hello, how are you all? So one of the most important topic in medicine is the circulatory failure, or what's called with shock. We all know that shock means underperfusion of the tissues, and this is mean that there is no enough oxygen and the nutrients that reaching for that tissues. And sometimes medical students may miss the definition of shock with hypotension, and we must know that shock is not hypotension. Hypotension, it's one of the clinical features or one of the signs for shock. Hypotension means hypo, which is mean less, tension, which is the tension of the blood within the blood vessels. So this means the decrease in the blood pressure within the blood vessel. While shock means there is no enough blood perfusion for that tissue. So the shock is related to the tissue such as brain, kidney, liver, and so on. So what are the clinical features of shock before we talk about the types of shock? These are the clinical features of shock. First of all, rapid shallow respiration, tachycardia, which means that the heart rate per minute will be more than 100 beats per minute, because we know that the normal heart rate for young adult is between 60 and 100 beats per minute. So as a compensation, when we have a circulatory shock and there's a decrease in the perfusion of the blood to the tissue, so the heart try to compensate that by increasing the heart rate. So the patient will have a tachycardia. As well as we say, the patient will have a hypotension, and hypotension is one of the late manifestation for the circulatory shock. Means the systolic blood pressure will be less than 100 millimercury. So we can keep it like this: tachycardia, heart rate more than 100 beats per minute; hypotension, systolic blood pressure less than 100 millimercury. Also, the patient can suffer from drowsiness, confusion, or irritability, and this due to the underperfusion for the most vital organ in the body, which is the brain. Okay, because we know that the brain consumes about 20% of the cardiac output, only just for the brain. So when we have a circulatory shock, regardless the cause, so the brain will be one of the first organs to be affected. Also, like the brain, the kidney will also be one of the first to be affected, and the patient can have an oliguria. Oli means like a hypo, or oliguria means the urine output will be less than 0.5 ml/hour per kg. As well as at the end, we will have a multi-organ failure, in which means that the respiratory system will be affected, the kidney system, the heart as well, the liver, the pancreas, the GI tract, and so on. We have four main types of shock, circular shock. We have the hypovolemic shock, which is the most common type, which means reduction in the blood volume. Okay, reduction in the blood volume due to bleeding, major bleeding or major hemorrhage, like a patient that undergo a trauma, a big trauma, and suffering from bleeding. Severe burns, because severe burns can lead to third space fluid loss. Third space fluid loss will lead to reduction in the blood volume, because we know that the blood components, plasma, which is mainly of water, and the cells, mainly the RBCs. Also dehydration, and we mean by dehydration when the patient suffering from severe vomiting and severe diarrhea multiple times per day for weeks and days. So the first type of shock is the hypovolemic shock. Another types, we have cardiogenic shock, and here is the problem within the heart. So we don't have a reduce in the blood volume, but we have a problem of the pump of that blood, which is the heart, due to heart failure, such as when the patient suffer from myocardial infarction, means the death of the cells of the walls of the heart, or maybe patient suffering from a valvular dysfunction acutely can lead to cardiogenic shock. Also, we have another type of shock, which is the obstructive type of shock. And here we don't have a reduction in the blood volume and nor a problem within the pump, which is the heart itself, but we have an obstruction to the blood flow from the heart. Okay, so obstructive shock means there's an obstruction to the blood flow around the circulation, such as, and these are very important differential for obstructive shock: the pulmonary embolism, but the major or severe type pulmonary embolism, the diffuse pulmonary embolism, the cardiac tamponade, which means that there is an accumulation of a fluid within the pericardial sac around the heart, so this will obstacle the heart from pumping the blood effectively. And tension pneumothorax, not any type of pneumothorax, because we know that there is spontaneous pneumothorax, there is simple pneumothorax, but what causing obstructive shock? Tension pneumothorax. And we must know that all of these types of shock have the same, mainly all will lead to these clinical features, but there are some difference between them a little bit, but we're gonna talk about them in another video. And also there is a shock type when we have vasodilation and shock. Okay, so you can feel it like a paradox, but it's not. Like the septic shock, the anaphylactic shock, and the neurogenic shock. So here we can conclude that when we have a vasodilation, the patient won't be cold like another type. The first types of shock, the patient will have a cold extremities, okay, because as a compensation, as we say, there will be an obstruction in the blood vessel and increase in the heart rate in order to increase the perfusion for the tissues in order to work effectively. Okay, but in these types of shock we have a vasodilation, and this means that the patient will have a warm extremities, not a cold extremities. And the septic shock means, we know that sepsis, when we have infection within the blood, okay, leading to signs and symptoms. Because you might ask that what is the difference between sepsis and septicemia? Septicemia means that we have an infection caused mainly by bacteria. Bacteria have endotoxin or exotoxin released within the blood, but not causing a clinical manifestation. But when that infection within the blood, okay, causing signs and symptoms like tachycardia, like hypotension, so we call it a sepsis. Okay, so we have an infection or other cause systemic inflammatory response syndrome leading to endothelial damage and leading to vasodilation, and vasodilation will decrease the perfusion for the tissues when we have a diffuse or systemic vasodilation within the whole bodies. Okay, and this can result in organ failure. So sepsis, as well as anaphylactic. So what the difference between anaphylaxis and sepsis? Anaphylactic, which is inappropriate vasodilation triggered by an allergen. It can be allergen from a food like eggs, from a bee sting. Okay, this will lead to vasodilation within the whole body. The patient will suffer from rash, from angioedema, from as well as shock, circular shock, leading to hypotension and tachycardia. What about the last type of shock, which is the neurogenic? And from its name, neurogenic means that it's caused by major brain or spinal injury, and this will disturb the brain stem and the neurogenic vasomotor control. And that's it. So just know that the main types of shock are the hypovolemic, which is the most common type, the cardiogenic, the obstructive, and the vasodilative. That can be divided into septic type, anaphylactic, and neurogenic. And next video we can talk about the management.